Slide 1 sets the stage for exploring substance use disorders, acknowledging their diverse manifestations and the complexities they entail. Substance use disorders cast a wide net, encompassing a spectrum of conditions where the use of various substances, spanning from alcohol to opioids, can precipitate significant impairment and distress. This comprehensive guide embarks on a journey into the landscape of these disorders, arming you with the knowledge to discern, comprehend, and navigate the challenges they pose. Slide 2 sheds light on alcohol use disorder, delineating the importance of recognizing its signs and symptoms for effective management. In the realm of alcohol use disorder, the CAGE questionnaire stands as a gold standard screening tool, offering a succinct assessment of an individual's alcohol use patterns through 4 key questions. This instrument serves as a valuable first step in identifying those who may be grappling with problematic alcohol consumption and guiding subsequent interventions. Moreover, recognizing the distinct signs and symptoms of alcohol intoxication and withdrawal emerges as a cornerstone of acute management. While alcohol intoxication may necessitate immediate supportive measures such as hydration and monitoring, alcohol withdrawal mandates a different therapeutic approach, often involving pharmacological interventions to mitigate withdrawal symptoms and prevent complications. Beyond the acute realm, alcohol use disorder poses a myriad of long-term health risks, including serious liver complications such as cirrhosis and esophageal varices. These sequelae underscore the importance of close monitoring and management, emphasizing the need for comprehensive care that addresses both the physical and psychological dimensions of alcohol use disorder. Slide 3 looks into the multifaceted landscape of treating alcohol use disorder, offering insights into diverse therapeutic modalities and pharmacological interventions. In the realm of alcohol use disorder, long-term management entails a holistic approach that integrates various therapeutic modalities and support services. Psychotherapy stands as a cornerstone of treatment, with cognitive behavioral therapy, CBT, emerging as a prominent intervention aimed at addressing maladaptive thought patterns and behaviors associated with alcohol misuse. Additionally, community support services like Alcoholics Anonymous offer a vital network of peer support and accountability, fostering camaraderie and resilience in the journey towards recovery. Pharmacological interventions play a pivotal role in supporting recovery and preventing relapse in individuals grappling with alcohol use disorder. Medications such as naltrexone, acamprosate, and disulfiram serve as valuable adjuncts to psychotherapy, targeting neurobiological pathways implicated in alcohol dependence and craving. Moreover, the acute management of alcohol withdrawal syndrome requires prompt intervention to mitigate potentially life-threatening symptoms. Benzodiazepines, such as chlordiazepoxide, stand as the mainstay of treatment, offering sedation and symptom relief while preventing the progression to severe withdrawal complications such as seizures and delirium tremens. By embracing a comprehensive treatment approach that integrates psychotherapy, community support services, and pharmacological interventions, clinicians and caregivers can pave the way towards recovery and resilience for individuals grappling with alcohol use disorder. Through collaboration and commitment to holistic care, the journey towards healing becomes illuminated, offering hope for a brighter future free from the shackles of addiction. Slide 4 explores the complexities of benzodiazepine use disorder, shedding light on its diverse manifestations and acute management strategies. Benzodiazepine use disorder casts a shadow over cognitive function and emotional well-being, precipitating a cascade of impairments ranging from impaired cognition and memory to heightened anxiety, anhedonia, and depression. These profound effects underscore the gravity of benzodiazepine use disorder and the imperative of timely intervention. In instances of benzodiazepine toxicity, swift action is paramount to mitigate the adverse effects of intoxication. Flumazenil stands as the antidote of choice, offering a means to reverse the effects of benzodiazepine intoxication and restore cognitive and physiological function. Furthermore, patients struggling with benzodiazepine withdrawal may traverse a tumultuous path marked by tremors, autonomic instability, and seizure activity. Given the potential for severe complications, hospitalization is often warranted, providing a controlled environment for monitoring and intervention. A tapering dose of benzodiazepines under medical supervision serves as a cornerstone of treatment, mitigating withdrawal symptoms and minimizing the risk of rebound phenomena. Slide 5 takes a look at the landscape of opioid use disorder, outlining its defining features and acute management strategies. Opioid use disorder manifests as a constellation of symptoms encompassing drug-seeking behavior, intense cravings, increased tolerance, and a spectrum of physical and psychological distress. From agitation and anxiety to insomnia, myalgia, and fatigue, the manifestations of opioid use disorder paint a complex picture of suffering and dependency. In instances of opioid intoxication, prompt intervention is imperative to mitigate the risk of life-threatening complications. Airway management and ventilator support offer critical measures to ensure adequate oxygenation and ventilation. The administration of the opioid antagonist naloxone stands as a cornerstone of treatment, swiftly reversing the effects of opioid overdose and restoring respiratory function. Moreover, navigating opioid withdrawal syndrome demands a comprehensive approach that addresses both the physical and psychological dimensions of dependency. Detoxification programs offer a structured pathway towards recovery, with options such as methadone maintenance or buprenorphine therapy, providing pharmacological support to alleviate withdrawal symptoms and mitigate the risk of relapse. Opioid use disorder intervention involves a multifaceted approach to acute management, and clinicians and caregivers can offer hope and healing to individuals grappling with the challenges of addiction. Slide 6 offers insights into stimulant use disorder, unraveling its effects on cognition, mood, and physiological function. Stimulant use disorder casts a shadow over mental and physical well-being, triggering a cascade of effects that impact social, occupational, and physiological aspects. Stimulant intoxication is characterized by a sense of euphoria, coupled with impaired social and occupational functioning. Physiological symptoms such as hypertension and tachycardia underscore the profound impact of stimulant misuse on the body's equilibrium. On the other hand, navigating stimulant withdrawal involves managing dysphoria, fatigue, insomnia, and psychomotor retardation. Although withdrawal symptoms can be distressing, they typically resolve with time and supportive care, often without requiring specialized treatment interventions. In instances of stimulant intoxication, acute management may involve the use of pharmacological agents such as antipsychotics or benzodiazepines to address agitation and psychosis and stabilize physiological parameters. However, the management of stimulant withdrawal typically does not necessitate specific interventions, as symptoms tend to diminish with supportive measures in time. Slide 7 sheds light on the complexities of tricyclic antidepressant, TCA overdose, outlining its diverse array of symptoms and acute management strategies. Tricyclic antidepressant overdose presents a spectrum of symptoms ranging from dry mouth and urinary retention to confusion, tachycardia, hypotension, and cardiac arrhythmias. These manifestations highlight the severity of TCA overdose and the necessity of prompt intervention. The initial management of TCA overdose requires a multifaceted approach aimed at reducing toxicity and stabilizing the patient's condition. This includes interventions such as intubation, gastric lavage, and the administration of activated charcoal to prevent further absorption of the drug. Close monitoring and stabilization of vital signs are essential components of acute management, ensuring the patient's safety and well-being. Addressing the cardiac manifestations is paramount in treating TCA overdose, as these pose significant risks to the patient's health and survival. Prolonged QTC interval and slowed intracardiac conduction are characteristic features of TCA toxicity, requiring targeted interventions to restore normal cardiac function. Intravenous sodium bicarbonate is a cornerstone of treatment, counteracting the cardiotoxic effects of TCAs and stabilizing cardiac conduction. Slide 8 illuminates the intricacies of Wernicke-Korsakoff syndrome, elucidating its progression and imperative treatment modalities. Individuals experiencing alcohol withdrawal syndrome face a heightened risk of developing Wernicke syndrome, a reversible condition marked by the destruction of the mammillary bodies. Prompt intervention is essential, with treatment involving the administration of intravenous thiamine, glucose, folic acid, and pyridoxine to mitigate neurological damage and restore metabolic balance. Failure to address Wernicke syndrome promptly can precipitate the onset of the irreversible Korsakoff syndrome, characterized by profound amnestic disorder and cognitive impairments. Preventative measures are paramount in the management of alcohol use disorder, underscoring the importance of early intervention and comprehensive care to avert the progression to Korsakoff syndrome. Slide 9 provides insights into distinguishing between intoxication and withdrawal, elucidating their distinct features and effects on the individual. Intoxication represents an amplification of the substance's effects, resulting in an escalation of the listed side effects and adverse reactions. This can manifest as heightened energy, euphoria, and physiological symptoms such as tachycardia and hypertension. Conversely, withdrawal signifies the reversal of the excessive effects induced by intoxication, often leading to contrasting symptoms such as depression, malaise, and insomnia. The specific withdrawal manifestations vary depending on the type of substance involved, reflecting the complex interplay between neurochemical pathways and physiological responses. It's essential to recognize that certain substances, such as cannabis and hallucinogens, carry minimal risks for dependence or withdrawal symptoms. In contrast, others, like PCP, may exhibit distinctive patterns of intoxication and withdrawal, necessitating tailored approaches to assessment and management. By elucidating the disparities between intoxication and withdrawal, clinicians can refine their understanding of substance-related disorders and tailor interventions to meet the unique needs of individuals grappling with addiction. Through comprehensive assessment and targeted support, the journey towards recovery is facilitated, offering a pathway towards resilience and well-being amidst the challenges of substance misuse. Slide 10 tackles the multifaceted nature of substance use disorders, underscoring the need for comprehensive and personalized approaches to management. Effective management of substance use disorders necessitates a holistic framework that integrates psychotherapy, community support, and tailored pharmacological interventions. This multifaceted approach addresses the diverse array of factors contributing to substance use disorders and offers a pathway towards recovery and resilience. Each individual's journey necessitates a treatment plan that is tailored to their unique needs. Factors such as the severity of the disorder, co-occurring conditions, and individual preferences must be carefully considered in developing a personalized approach to care. Recovery from substance use disorders is a dynamic and ongoing process, requiring sustained commitment and support. Ongoing engagement with healthcare professionals and participation in community-based support networks are essential components of long-term recovery, offering individuals the resources and resilience needed to navigate the challenges of addiction and promote lasting well-being. Slide 11 highlights the relationship between substance use disorders, SUDs, and associated comorbidities, emphasizing the critical importance of implementing a comprehensive management and vigilant monitoring. Alcohol use disorder, AUD, carries significant risks for a myriad of medical complications, notably including serious liver conditions such as cirrhosis and esophageal varices. These complications necessitate close monitoring and diligent management to mitigate the potential for further deterioration and ensure optimal patient outcomes. Delirium tremens, DTs, a severe manifestation of alcohol withdrawal syndrome, poses a grave threat to individuals grappling with AUD. Marked by autonomic instability, rapid deterioration of mental state, and alcoholic hallucinosis, delirium tremens demand immediate intervention to prevent life-threatening complications and safeguard patient well-being. Furthermore, individuals with alcohol use disorder face an elevated risk of developing Wernicke syndrome, a reversible condition characterized by neurological deficits stemming from thiamine deficiency. Without timely intervention, Wernicke syndrome can progress to the irreversible Korsakoff syndrome, marked by profound amnestic disorder and cognitive impairments. Preventing the development of Korsakoff syndrome is paramount in the management of alcohol use disorder, underscoring the critical importance of early intervention and comprehensive care. By elucidating the complex interplay between substance use disorders and associated comorbidities, clinicians can refine their understanding of addiction and tailor interventions to meet the unique needs of individuals grappling with AUD. Slide 12 underscores the significance of substance use disorders. In the clinical case simulation, CCS portion of the exam, particularly focusing on the management of tricyclic antidepressant, TCA overdose, a high-yield topic. Candidates must be well versed in the specific sequence of interventions required to manage TCA overdose effectively. This includes interventions such as intubation, gastric lavage, and the administration of intravenous sodium bicarbonate. Mastery of these concepts is essential for success on the CCS portion of the exam. To adequately prepare for the CCS exam, candidates are encouraged to utilize comprehensive resources such as the UWorld CCS software. This platform offers interactive and readout cases that simulate real-life scenarios, providing invaluable practice and familiarity with the format and expectations of the exam. By the way, I am not affiliated with UWorld CCS software, and I am not receiving any financial incentive for mentioning or promoting this product. Additionally, candidates can benefit from engaging with supplementary resources such as Archer's CCS workshops and pre-recorded sessions. These resources offer further insight and practice opportunities, bolstering candidates' confidence and readiness for the exam. It should be noted that I am not affiliated with Archer's CCS workshops or pre-recorded sessions, and I am not receiving any financial incentive for mentioning or promoting these products. Regular practice with NBME software cases is also essential for success on the CCS portion of the exam. Staying abreast of the latest exam format changes and updates ensures that candidates are well prepared to navigate the standardized but evolving format of the CCS exam. By investing time and effort into comprehensive preparation strategies, candidates can approach the CCS portion of the exam with confidence and competence, ultimately maximizing their chances of success. Slide 13 brings forth the distinctive characteristics of cannabis and hallucinogens, highlighting their unique properties and management considerations. Cannabis, characterized by a negligible risk for dependence or withdrawal symptoms, occupies a relatively low-risk position among psychoactive substances. This distinction underscores the importance of recognizing the diverse spectrum of substance use disorders and tailoring interventions accordingly. Similarly, hallucinogens, including LSD and psilocybin, present minimal risks for dependence or withdrawal. Their intoxication is typically managed through supportive care, reflecting the distinctive nature of their effects and pharmacological profiles. While cannabis and hallucinogens may not necessitate specialized treatment for withdrawal, it remains imperative to remain vigilant of their unique effects and potential risks. Healthcare professionals must remain cognizant of any co-occurring conditions that may complicate management, ensuring a holistic and individualized approach to care. By comprehensively understanding the properties and implications of cannabis and hallucinogens, clinicians can provide informed guidance and support to individuals navigating substance use disorders. Through tailored interventions and vigilant monitoring, the journey towards complete recovery. Slide 14 addresses the ethical considerations inherent in the management of substance use disorders, emphasizing the importance of adopting a harm reduction approach and cultivating a compassionate, non-judgmental attitude towards patients. A harm reduction approach prioritizes the well-being and safety of the patient, eschewing rigid abstinence-based models in favor of pragmatic interventions aimed at reducing harm associated with substance use. This approach acknowledges the complex and multifaceted nature of substance use disorders, emphasizing harm minimization and support rather than punitive measures. Healthcare professionals must approach patients with substance use disorders with empathy and understanding, recognizing the deeply personal and often stigmatized nature of these conditions. A non-judgmental attitude fosters trust and rapport, essential components of effective therapeutic relationships. Ethical dilemmas may arise in the management of substance use disorders, such as the provision of alcoholic drinks during alcohol withdrawal syndrome. In such situations, healthcare professionals must carefully weigh the potential benefits and risks to the patient's well-being, ensuring that decisions are guided by principles of beneficence, non-maleficence, and respect for patient autonomy. Slide 15 encapsulates the essence of addressing substance use disorders through a holistic and individualized approach, emphasizing the complex nature of these conditions and the importance of comprehensive care. Effective management of substance use disorders necessitates a multifaceted approach that integrates medical treatment, psychological support, and community-based resources. This holistic framework acknowledges the diverse array of factors contributing to substance use disorders and seeks to address them in a comprehensive manner. Each individual's journey with substance use disorders is unique, shaped by personal experiences, co-occurring conditions, and individual preferences. As such, treatment plans must be tailored to meet the specific needs of each patient, ensuring that interventions are relevant, accessible, and effective. Recovery from substance use disorders is a lifelong process characterized by ups and downs, successes, and setbacks. Ongoing support, both from healthcare professionals and within the community, plays a pivotal role in sustaining recovery efforts, preventing relapse, and promoting long-term well-being.